to you?
Yeah, so this study, we looked at lifestyle behaviors and the risk of incident chronic kidney disease. Essentially, the whole crux of the problem is that the obesity rates in the U.S. are going up, and as we know, hypertension and diabetes rates are also going up, and a lot of that is probably related to obesity itself. If you look at kidney disease, you would expect that since hypertension and diabetes are the biggest risk factors for kidney disease, you would also get an increased risk for kidney disease as well. So what we want to do is look at underlying lifestyle behaviors and how they could associate with kidney disease 20 years later down the line in young adults. So essentially we have participants from the CKD study, which these guys are 18 to 30 years old. They were originally recruited to look at cardiovascular risk factors in young adults, and half of them were black, half of them were white, and there's 20 years follow-up. We only included people that were normotensive and did not have diabetes and had normal kidney function, and then we looked at their risk of kidney disease 20 years down the road. So what we found was, of the people that developed kidney disease, they're more likely to be obese, more likely to have a poor diet, more likely to smoke, and the diet score that we devised was actually based on the DASH diet, and the DASH diet is the diet used in the Dietary Approaches to Stop Hypertension diet, where it showed it was about as good as using a medication to lower people's blood pressure just by this diet, and it really is high in intake of fruits, vegetables, whole grains, nuts, low-fat dairy products, and then minimizes the sodium, the sugar-sweetened beverages, red and processed meats. So essentially, if you followed a diet that was very much unlike the DASH diet, so a very unhealthy diet, you had twofold increased risk for kidney disease compared to people that ate a more DASH-like diet. If you were obese, you had nearly threefold increased risk of developing kidney disease, and that kind of goes in line with what we've already thought. It looks like most of the obesity-related relation to causing kidney disease in our study looks like it would probably be mediated through hypertension or diabetes, because you can see the risk for developing kidney disease from developing hypertension and diabetes is quite high in our study. But I think the most striking thing is that nutritional factors themselves could actually cause kidney disease, and following a diet such as the DASH diet could decrease your risk of kidney disease, and avoiding smoking and avoiding a sedentary lifestyle, trying to stay at a normal weight could really help prevent kidney disease. Now, all this stuff is hard to tell in a young adult who looks pretty healthy in general, except maybe they're obese. So really, I think this is necessary. It's necessary to make public health interventions to kind of guide people in avoiding all these unhealthy lifestyle behaviors and helping prevent the risk of kidney disease in the future, as well as cardiovascular disease and cancer mortality.